Excellent. Welcome to No Wrong Turns, exploring your career path in global and public health. Let me tell you a little bit about me. My name is Candela Iglesias. I am the founder and director of Alanda. We are an organization focused on supporting international organizations to improve their projects, their health projects based on a better use of evidence and improved trainings based on adult learning sciences. We also have a separate arm called Alanda Academy, where we develop online courses that we try to make accessible to as many people working in global and public health as possible. I also give a lot of lectures or participate in a lot of career days at universities. And some of the things that I'm talking about here is also things that I talk about in these master courses. So great if you can find me on LinkedIn and connect there. I'd love to see you there as well. You can connect with Alanda as well on LinkedIn if you want to know more about our webinars. Okay, so what are we covering today? What are we going to be talking about today? I do a lot of mentoring. We have interns at Alanda, and they ask me a lot of smart questions. So I'm going to be trying to answer the most common questions I get here today. And those questions are, what are my career options outside of academia? Because people normally, when you're in a master's, you might not be able to see all the possibilities that are out there. So we're going to be covering that. The second most common question I get is, how do I manage to get a job? Like, I am getting rejection after rejection after rejection, or just no answers to my job applications. What's going on? So we're going to be talking about that and about potential alternative solutions. And then we'll have a big chunk of time dedicated to your questions, and I'll try to answer as many of those as possible. Unfortunately, we rarely get to answering all the questions because there are so many of them, but we try to make sure that we answer any questions that we didn't get to during this webinar in our LinkedIn posts or via our emails. So hopefully you'll get an answer to your questions anyway. And lastly, I'll be talking about if this webinar does not answer all your questions and you still feel a need for more support as you're developing your career in global and public health, I'll be briefly talking about our Thrive online course, which is geared towards young public and global health professionals who are just starting out. So you can see a little bit what's available there. And we've revamped it this year, so lots of good stuff in there. Excellent. So make sure that you add your questions in the chat as we go along, and then we'll collect them to start answering them when the time comes. Great. Let's start with this. What are some career options in global and public health? And I want to start by acknowledging that the space has shrunk in the past year. You are all aware of the huge cuts in aid, in particular to public and global health around the world that happened last year. So this space has shrunk. That said, every day I still hear about people finding new jobs in our sector on LinkedIn or via email, or people just pinging me that they got a new job. So jobs are out there. They might be a bit more competitive than they used to be, but the jobs are still out there. And the size of each of these buckets has probably shifted as well. So one of the job buckets that you're most familiar with is academia. And that is because you've done your bachelor's, you've done your master's, and you've heard about from your professors, many of which probably have a job inside a university or a think tank or a National Institute of Public Health. You can also think about government. And government is not just the Ministry of Health. There are health-related and public health-related positions in many other dependencies within health. For example, now more and more there's a work between the ministries of finances, the Ministry of Health, the Ministry of Agriculture and Environment to work towards One Health outcomes. So there are positions in other ministries as well. And then when you think about government, you also need to think from the top all the way to the local level. There are positions at each level of the administration, from the municipal, the provincial, the regional, the state level to all the way to the national level. What normally happens is that you have like the healthcare structure, and parallel to that healthcare structure, primary healthcare, secondary healthcare, tertiary healthcare, and then all the way to the national reference hospitals. Parallel to that, you have a public health infrastructure that might be based around surveillance, that might be based around public health actions all the way to the top. So you can find those local opportunities or those region or provincial opportunities as well within the government. Government positions are normally not as well paid as other opportunities, but it's a real chance to do meaningful work. It's very much hands-on either at the implementation level or at the policy level. We also have the UN, and this is a space where options have shrunk definitely last year. When we talk about the UN agencies, most people think about WHO, and of course WHO is the one that has most opportunities in global and public health, but we also have UNICEF, we have UNAIDS, we have UNDP. UNAIDS and UNDP have been very hardly hit by the aid cuts. That's a reality. And we have other UN organizations that also have health or global health related jobs. So don't only focus on WHO when you're searching. Expand your search and you might find interesting opportunities as well. One area that is not shrinking and that it seems to be increasing in size is actually the foundations. Many foundations, whether private or more transnational, have stepped up their game in response to the aid cuts. Work at the foundations can be very hands-off, right? It can be grant management or project management. It can be, about thinking around innovations, thinking about what, doing analysis on what spaces need more financial support, etc. But it still can be very meaningful work, and depending on the size of the foundation is the type of salary that you can be looking at. So big foundations, especially big international foundations, normally pay really well, and they might even have offices around the world and not just at headquarters, right? And then there's a lot of national and even local foundations that you might look into, where you might be able to do a lot more interesting work, much more hand in hand with the organizations that the foundation is supporting. And then there's the global organizations, right? These include public-private partnerships. These include international organizations that don't necessarily fit neatly into one of these categories. The Global Fund for HIV, Tuberculosis, and Malaria. You can find here. Gavi, the Vaccine Alliance, for example. And then there are some new players in the sector, not so new anymore, but CEPI, the Coalition for Epidemic Preparedness Innovation, which has headquarters in both Oslo and in London, and focuses very much on shortening the time to vaccine development and and liberating those vaccines for distribution, and also focuses on neglected areas where we urgently need a vaccine because there might be an outbreak sooner than we would expect. So global organizations, yes, funding has shrinked here as well in many of these, but others, especially those who have more private funding, might be not as hardly hit. One bucket that not everybody has in their sight is development banks. So you have the World Bank, of course, which has a lot of health projects and a lot of need for health economics, public health people, etc. But you also have the regional development banks. And the Asia Development Bank, the Africa Development Bank, the America's Development Bank, etc. So you can look into positions in these development banks because they will, most of them have support for health projects, and thus will need people who have health expertise. And then one area that you're probably more familiar with is the not-for-profit and social enterprises. Here we have everything from the big international NGOs, such as, Doctors Without Borders, Save the Children, CARE, all the very big ones, to all the way to the local level, passing through national not-for-profits or national social enterprise, all the way to the very, very small local level. Here you might either build one or you might join one, especially the bigger ones might have more positions available, but there is a lot that you can find at your local level. So going and exploring what's available in your city, in your community, in your locality. Many of those might be grassroots organizations. They might not have a lot of positions. They might not have a lot of money, but it's easier to get in. It's easier to knock on the door, do some voluntary pro bono work for them, and then, try and get a paid position there. So a lot to explore here, and a lot of innovation also happening on the smaller levels of these social enterprises that you might want to, contribute to. And finally, we have the private companies bucket. And these private companies, I guess the majority of those are the big pharmas. But there's also more and more proliferation of health tech companies. And similarly to what I'm describing in the other buckets, it's not only the big ones, it's not only the big players, those are the most visible, but you have private companies all the way down to the level of local startups. A startup is an organization that is looking for funding to, or that has its first round of funding to get a minimal viable product off the ground, or a minimal viable innovation off the ground. And these startups and the next level that are called scale-ups are places of a lot of dynamism, a lot of innovation, a lot of good things happening, also sometimes very chaotic depending on who the leader of these organizations is. But there are usually a lot of cool opportunities there that you might not have in your radar right now. So go and explore what's happening there. The beauty of the startups, again, similar to the smaller local NGOs, is that they need people, they need hands, they need brains. And if you come knocking and say, hey, I can bring this in, they might not be able to pay you straight away, or they might pay you something very minimal. But you might, if they do well, they might give you equity, they might give you other benefits. And you might be able to test a lot of hats. What happens when you are in a very small organization is that you are not only going to be the senior health advisor, you are also going to do project management, you're also going to do innovations, you're also going to do finances, you're also going to do marketing. You're going to be wearing a lot of hats. So if you're a very curious person and you want to test out as many things as possible, these local social enterprises, local grassroots movements, these local startups might be the place for you. Go and explore those, I would say. Okay, great. I see that there's some questions coming in. I'm going to tackle those when we get to the Q&A section. But for now, I just want to keep going so we can cover all of the sections. So the next question that I wanted to talk about is, why am I not getting any job offers? Why am I just getting rejection after rejection? This is a very frustrating situation for most young public and global health professionals. I've heard about it a lot. I've experienced it myself as well. It really is very hard to manage for us. And I'm not saying that I'm going to give you the magic one to solve this, but I want you to understand what are the problems happening here, and what can you do to try and circumvent this problem of how hard it is to get a job. There's two main issues that I like to talk about that are not so widely known, and many times in your master programs they might not talk about them. One is what I like to call the iceberg effect. The reality is that the majority of the jobs that you see advertised on LinkedIn, on Indeed, on Glassdoor, on Monster, on any sort of job search engine that you might think about, is just the tip of the iceberg, is a part of the iceberg that is above the water. The rest of the jobs never get advertised. Depending on the country and on the city and on the sector, the size of this mass of jobs that is underwater can actually be larger than the jobs that do get advertised. And that's a reality in every single country in the world, no matter how strong the regulations around asking companies to advertise every single one of their jobs. So what are these jobs that never get advertised? There are jobs that either only get advertised internally within the company. There are jobs that are created on the spot because they have a volunteer and they don't want to let go of that volunteer because that person is excellent, so they create a job for them and they don't advertise that job. There are positions that they only ask their reference and their network to fill, but they never advertise it publicly. Now, for many organizations, this is not legal. Many organizations, especially UN organizations, are required to publicly advertise every single job position. That does not mean that they don't already have a candidate for that position, unfortunately. So whether we like this or not, and we might be very against this because it is an unfair process, this is the reality. This iceberg effect exists. So what I want to give you is tools to work around this. Basically, if you're only targeting jobs advertised online, if that is all you're doing in terms of looking for jobs, then you're not targeting, then you're missing out on all of this big iceberg underneath. And I'm going to talk about how do you target those unseen jobs. Similarly to the iceberg effect, we have this gatekeeper effect. Oh my gosh, this does not upload correctly. But basically, imagine that this is you, and you have a gate to the organization where you want to enter. Behind that door, there's people, and those people are the gatekeepers. Behind those gatekeepers are actually the people in your field, the senior health advisors, the health implementers, the epidemiologists, whatever their title is. The people in your field are the people who speak your same language, is the people like you, people that you would be able to understand each other because you both work in the same field, you both studied the same things. Those people are hidden behind these gatekeepers and this gate. The gatekeepers are the HR people, the human resources people. And they might be very lovely people, but the reality is that their job is to keep out most of the candidates and just let a few selected ones trickle in. So if you're going, and more, that gate are bots, right? Are automatic systems that filter our CVs through very narrow criteria and just let a few CVs that comply with certain formats and certain keywords to come into the gatekeepers, right? So we want to go around this. We want to skip the gate and the gatekeepers, and as much as possible to target those underneath the water jobs, we need to talk to the people in our fields within these organizations, okay? So the way to do that, the way to get around and target these jobs that are underwater and to talk to is by talking not to the gatekeepers, but by talking to our peers who are within the organization, working in health, in public health, in global health, in epidemiology. And the way to do that is by not only focusing on sending out job applications to advertise job offers, but also working a lot on building your network. And when I say networking, a lot of people think, a one-off connection, meeting someone at a conference, talking to them once, and that's it. That's not what I mean when I talk about networking. Networking for the purposes of having a meaningful career, of building your opportunities as you grow along, is about relationship building, long-term relationship building. This is not a short game. A job for you is not going to materialize because you connected with 3 people at a conference. You might be very lucky, and then, one of those people would absolutely love you and offer you a job. Most likely, this is not going to be a case. It's a long-term game. It's a long-term strategy, but you need to put in the hours and the work. So, what does what I call one-off networking look like compared to relationship building networking, which is what really builds that network around you, where jobs start to come to you instead of you having to send out job applications. One-off networking looks like this. I find a stranger on LinkedIn that works at the organization that I'm interested in. I send them a CV and I ask them for a job, or ask them to recommend me. Now, these people don't know me. They don't owe me anything. And why would they give me a job or recommend me if they don't know me? I've just sent them a CV. That's quite intrusive, right? So this is a strategy that doesn't normally give good results. Similarly, you meet a person at a conference, you hit it off, and you send them a CV and ask them for a job the next day. It's unlikely to work. You might very get lucky, and then I'll be very happy for you, but it's unlikely to work. What I talk about when I talk about networking is this long-term relationship building. You're not asking people for a job, you're building a relationship. And eventually, maybe after 6 months, maybe after a year of ongoing contact, then you can say, hey, I really liked everything you told me about your organization. If there's any openings, would you send them my way? But that's not asking for a job. That's asking them to refer to you any opportunities that come up. It's a very different ask. It's a much smaller ask. So what I talk about relationship building is like, okay, I research a stranger on LinkedIn. I find 5 or 10 that work in organizations that I'm really curious about. And then I start building a relationship with them. It's very easy to do these days on LinkedIn. I comment on their posts. I reshare their posts with my thoughts. I send them a message saying, I really appreciated your last post because this is an area I'm very interested in. You add value to the conversation, right? You don't just say great post. You add value to the conversation by bringing in your opinion, your experience, and example. And then, after a bit of this, you send them a request to have a 10-minute virtual coffee, right? Or would you be able to meet with me for 10 minutes? I would love to hear your advice, as I'm a young public health professional. I'm looking for my first job, and I'm still exploring the opportunities out there. I would love to hear about how it looks like to work in the different organizations that you've worked with. That shows that you've done your due diligence on them. You've done your homework. You know where they've worked, and you're interested in those organizations. So asking for advice is a very easy ask, is an ask for which most of the time you will get a yes. Not every time. Many people will say no, but many times people will say yes to spare 10 minutes of their time to give you some advice. And that's because we're human beings and we actually all love to give advice. Think about when you talk about to your friends. It's just human nature. We all love to give advice, right? So you actually have that one-on-one coffee. You come very well prepared. You do a very brief introduction of yourself, and then you ask them very smart questions. After that, you send them a thank you message. And after them, you keep in touch. You say, hey, I've been thinking about the advice you gave me. This is very relevant to me because of A, B, and C. This is what I've tried next. This is what I've done next. And then you keep building that relationship over time. It looks very different as to that one-off networking. You build those relationships through what I like to call touch points. Every time a person hears about you or from you, that is a touch point. Connecting on LinkedIn, commenting on a post, sharing a post, requesting to chat, having that one-on-one chat, sending a thank you email, sending, 2 or 3 months later, sending an article saying, hey, I read this post and it reminded me of the conversation we had. I thought it might be interesting for you. That's a thoughtful little thing to do. And then you follow up and you keep building those touch points. And then, 6 months later, you say, hey, would you have 10 minutes to grab a coffee, a virtual coffee? I wanted to let you know what I've been doing after the advice you gave me last time, right? You keep building that relationship through these touch points. The more touch points you have, the more the other person feels like they know you. And that's what you want, because then it's easier to ask for a job or to ask, if there's any opportunities coming up in your organization. I'm very keen of trying to get a job in your organization, right? And then when you are asking for advice, it really pays off to have done your research. If you ask generic questions like, oh, do you like your job? Or how can I get a job like yours? Or what advice do you have for me? You're putting all the weight of that conversation on the other person. And that's not fair because you're the person looking for advice. What makes you really stand out is preparing that conversation, looking up that person, finding out as much as you can about them, and then coming into that conversation, having done your homework and having very smart questions. That is going to make you stand out, and that is going to give you much better chances that the person will say yes to having a conversation with them, or to, continue helping you and connecting with you over time. So I have a few examples here, but for example, I saw that you worked at organizations A, B, and C. Could you tell me what you liked the most about each and what did not work for you? I saw that you transitioned from this type of position to this type of position. How did you manage that pivot? What helped? What would you do differently today, right? These are very in-depth questions. And, today you can use AI. You can use AI, give them a bio or the LinkedIn of this person and say, hey, what are 10 smart questions that I can ask? And please don't ask the 10. You won't have time for 10 in a 10-minute conversation, but you can pick and choose the ones that seem most relevant to you, okay? Great. So we talked about the two challenges into getting a job, gatekeepers effect and the iceberg effect. And we talked about how you can use networking as a strategy to get around these challenges. We also started today by talking about what are some options that exist out there in terms of types of organizations and types of jobs. Now I'm going to open for your questions. So I'm happy to try and answer as many of your questions as I can. Let me see what's in the chat already. Okay, someone is asking, how do you position yourself for employment? And also, how do you know the job role to apply for? Since public health is really broad, and in the most cases, the job title do not come off public health officer. Very true. So as part of this Thrive course, but we're thinking of providing this for free soon in our webpage at Alanda, we compiled a list of job titles that are related to global and public health positions and what they mean. So Julius, I'm sure you are working on this, so let us know in the chat, when do you think this can be available on the website, and we'll send it out via a newsletter so you can access this list. And in terms of how do you position yourself for employment, well, I think it's important to have a very strong LinkedIn profile and to make sure that you fill that about section very smartly. I don't have the time to go into depth about this, but if you ask AI or if you Google it, you will see that there are very smart ways to fill that about you profile section on LinkedIn. And then make sure your LinkedIn profile is complete. You could also ask for references within LinkedIn. And then a way to stand out is to actually put yourself out there, put out there what, post regularly, let other people see what you're thinking, what you're learning, what you're doing, the questions you're asking yourself about. You don't need to be an expert to be posting on LinkedIn, right? So that is also a way to stand out. I'm reading the questions, okay? Okay, I'm finding it extremely difficult to access stable entry-level roles in global public health. Many pathways seem to rely on unpaid internships or prioritize candidates based on geographic or socioeconomic background, which, while important for equity, can also create barriers for others who have self-funded their way into the field. How do you think the sector can balance equity and representation with fair access to early career opportunities, and what realistic pathways exist for someone in my position to enter the field without going through unpaid work? So this is a challenge. The reality is that there are a lot of entry-level jobs that actually require 2 to 3 years of experience. Like they actually say, oh, 2 to 3 years of experience, but it's an entry-level job. So it's like, what? There's a couple of ways to think about this. And I'm not saying it's easy, and I'm not saying I have the perfect solution. So you also need to hear other points of view, but this is mine. The first one is you do have experience. Even if you've just completed your master's, you already have experience. It might not be work experience if you haven't had a job, but that doesn't mean you don't have professional experience. It doesn't mean you don't have experience in global and public health. So as much as you can, try to figure out what those pieces of experience from your university years, from your waiter job, from having worked at whatever job you did while you were trying to pay your while you were studying, what did you gain in terms of transferable skills, even if it was not in global or public health, that you can put on your CV? Every little bit counts. If you've been, the head of a student leadership council, if you've, done these projects for your master's, these research projects for your master's studies, you were showing team leadership skills, you were showing research skills. So you need to pull all that experience out from your university years and put it in a format that shows that you have that experience in your CV. Okay. So my first recommendation is always, don't underestimate or don't negate the experience that you have from your studying years. Pull it out and make it very visible. The second one is, as much as possible, if you're still studying, find ways to do volunteer work, even if part-time. Find ways to do internships. I know it's annoying. I know it's not fair. I know many of us have actually to have a paid job to, pay our studies, to pay the university. But as much as possible, if you can spare a few hours a week, do some volunteer work in your field, because you can start building that network as well. And you can also start testing out different types of organizations and having a clear idea of what you like to do and what you don't like to do. The reality is that what you do in your studies is going to look very different from what you do in a job. And each job will look very different in the day-to-day. And many of those you might not like. So the more you can test the waters while you're studying through volunteer, through unfortunately unpaid positions, and you might find there's more and more paid internships, so thankfully. But as much as you can, test that out, it's all the better for you. And it doesn't have to be full-time, right? It can just be a few hours per week. And this is what I said, right? Like, it might be very hard to try and get into a global health position if I'm based in Oslo, Norway. But I might be able to get into a local position in a local organization. That might be an easier first step than trying to get a global health position where they're also prioritizing people who have contextual knowledge of the country or the region, or are people with the national to that country. So there's a way to try and start building those steps. And you might need to have a few steps before you actually get the ultimate career opportunity that you would like to have. Trying to get to the first questions. As an international student in London, I have experienced that it's difficult to get jobs there. How do you suggest one can navigate through this? Yes, that is a real challenge. Many of us change countries when we're doing our master's studies, or even for our bachelor's. And then our visas are student visas, and they don't allow us to work. So it becomes really challenging trying to get a job in that country where we've spent the last 2 or 4 years and where we might be wanting to stay for whatever personal or professional reasons, right? Unfortunately, I don't have the perfect tip for this. This is a reality. I think some countries and some cities have started to acknowledge this challenge and create some sort of like intermediate visas that would allow you to stay for 1 year or so while you finish your studies and start looking for a job. There are organizations, especially the larger international organizations, that will sponsor your visa. Not in every country, but some will. And I know this space is shrinking in many countries. This is a reality. I'm not going to lie. The other option is that there are a lot of fabulous people out there putting together sites compiling what they call no visa jobs. So fully remote opportunities, or jobs that will sponsor your visa, etc. So there are specific search engines for this. One that I like is called No Visa Jobs. But there are other efforts out there. So this is a good place to look if you're facing that visa challenge, that work visa challenge. And also, we go back to the same thing. When you have the relationships, when you've done the work, and when someone really, if you've been a volunteer or an intern at an organization and you've done a fantastic job and they really want to keep you, they might be able to circumvent their no sponsorships rules and make an exception for your case. So again, networking and building those relationships really can help you through all of these challenges that we're talking about. Can you give a bit of a thank you for the lovely webinar? Would be amazing. Thank you for that. It would be amazing to get that list of titles to search for jobs. Yes, we will let you know when this is available. We just need to set this up on the back end and actually update that list a little bit, because I think a lot of things change year by year. Can you give a bit of advice on how to structure your CV to stand out so that it's not filtered out through AI or thrown in a pile of other CVs? Again, It's not going to be thrown out if you already know someone in that organization who is interested in you coming in the door. So one piece of advice is spend a couple of hours as a minimum every week building your network. Super important. I know it's long term. I know it feels a waste of time, but believe me, you want to be at a point as soon as possible where you can reach out to people and say, hey, I'm interested in these organizations. Do you know someone there that I could talk to? Okay. Or I'm interested in this job in your organization. Do you think you can put in a good word for me? But you can't do that if people don't know you, if you don't have a strong relationship with those people. Okay, so build your network. That's my first piece of advice. Don't focus as much on your CV as on your network. Now, for the CV, yes, there are some things that you can do. We see a lot of CVs. We see probably around 400 CVs per year from young public and global health professionals applying to Alanda's internships. And I see a lot also through the mentoring and career development work I do with universities. Very few. So here's what it looks like. The bell curve, the standard distribution. It looks exactly like that. You have a bulk majority of the CVs that are in the middle. They're good CVs. There's nothing wrong with them, but they don't stand out. Then there's a tiny, tiny tail on this side of really standout CVs that really catch your attention. And then on the other side, you have a tail of really, really bad CVs, full of typos, terrible formatting, terrible structuring, terrible writing, like people really did not put a lot of work into it. So it's great if your CVs already, I'm guessing most of your CVs are already here under the bell curve, right? Like the bulk of that bell curve. They're already pretty good CVs. What you need to do is transform them into that, put yourself in the tail end there, really stand out CVs. The first way you do this is by never, ever, and I mean never, sending a standard CV anywhere. You tailor that CV to the organization and to the position. And to do that, you need to spend some time getting to know the position, reading about the position and then the organization. You need to do your due diligence. Believe me, it's super clear to us, both in the cover letters and in the CVs, who has done their due diligence, who has done their homework on who we are, who is Alanda, what do we stand for, what is our work about, and matching that to, and matching their CV to that. It's super clear. If you don't spend the time, if your strategy is, I'm going to send out as many CVs as possible, and that means I don't have time to tailor them, I can already tell you that strategy is not going to convert. You will have a very, very, very low conversion rate into interviews. So it can seem like it's more productive because you're sending 100 CVs a day, but in the end, it doesn't work out. It really pays out to select very carefully the positions you want to apply for, the organizations you want to apply for, and spend a lot of time doing your homework on that organization, on that position, and tailoring your CV and cover letter. Now, AI bots and automation software for HR normally work through keywords, right? So you need to understand, you need to parse through that job application and really think through what are the keywords. And today AI can do that for you, let's be honest, right? Like you need to still sort of check the work that AI does for you, but you can get that help, you can get that support. And there's people who really specialize on how to you get through that first barrier. And I'm not an expert on that, so I'm not going to say more than that. But having those keywords in is really important. The next part is both on your CV and your cover letter, showing that you did your due diligence. Why would I put this, like, if this experience is what's going to be most important for this position in this organization, Why would I put any other experience first, even if it's chronological? I'm not bound to write it my CV chronologically, right? So as much as you can in your summary section, in your CV, in your cover letter, make that match very clear, right? You are looking for someone with this type of research skills. In your cover letter, you can say, recently, during my previous internship experience, I was working in a very similar area and I did this and this and this, and these were my results. I think I can support this work that you're doing in this way. That really shows you did your homework, right? Not just that sort of random paragraph that we always see that, oh, I'm looking for a job at Zalanda because I really align with the values of your organization. That means nothing. You need to spell it out. You need to show that you know them. You need to know that you need to show that you know the organization. I'm more interested in remote work as a research assistant roles. Any ideas where to start? Really easy if you want a research assistant role to start within your own university. Go talk to the professors, build your network within your university, and ask them, who can I talk to? If this is the type of research I want to do, who can I talk to? Who should I be talking to? They know a lot of professors in other organizations and other universities. So that would be my advice on an easy starting point for research assistant roles. As a research technician considering a switch to the public health field, what kind of opportunities and things would you suggest seeking out to gain experience in the field while working prior to applying to an MPH program? Figure out what you like and then test through volunteer positions, through a bit of pro bono work. Just through, you don't even need to do that. You can ask people, hey, can I shadow you for a day? Can I just go there and shadow you for a day and you can tell me about what you do? I'm exploring what I want to do next. I would really appreciate it. But you need to build that relationship first for people to say yes, right? But shadowing, volunteering, and internships might also all be good. And, try to think about what value can you bring to them as a research technician, saying, hey, I can help you with that. Would you let me shadow you? No, do like an exchange. I can help you with this. Can you help me with that? Great. So there's a few more questions, but I think some of these I've already answered in one way or another. I'm going to do one more and then we'll continue. I have felt that a lot of people have MPH degrees, but not everyone I know with this degree has got a career in this space. I am now wondering whether it matters more to have work experience instead, irrespective of whether or not you have an MPH degree. I agree. Many people so until recently, I mean, at least from my age perspective, until recently, there were no bachelors in public health for starters. That did not exist. So everybody had a different bachelor, and then you either went on to do an MPH or you went on to do some other things and ended up working in public and global health. So that is still very, very common. But now there is a proliferation of master in public health programs. I don't know that one path works better than the other. I think as we go along, having that MPH credential might become more important because, the generations are changing and those programs today exist as opposed to, 20 years ago when they were very rare. The other thing I would say in favor of having the master's in public health is that it really gives you, and I'm a career changer. I come from a different sector. I come from the biomedical sector, and I switched careers many years ago towards public and global health. And I chose to do that master's even though I already had a job in public health. The reason I chose to do this, and this is my personal opinion, is because I wanted that framework. I wanted to understand things from the theoretical point of view that an MPH would give you. And it made a big difference for me. But that's how my brain works. You need to figure out how your brain works and whether you learn better or faster through work experience than through a master's degree. Okay? Great. Thank you for all those brilliant questions. We'll come back to those at the end if we still have a bit of time. But before leaving you, I wanted to talk a little bit about our Thrive online course. And the team has worked very hard on revamping it this year. This Thrive course is geared towards young public and global health professionals and those switching towards a global or public health sector. And it's for you if you don't know what your career options are out there, if you're very confused about this, and hopefully this webinar has given you a little bit of a better understanding of what's out there. But if you still have questions, you might find answers here. It's for you if you want to find meaningful work, but you're sort of like at a loss on where to look and, what would be meaningful for you. It's for you if you're having a lot of challenges in finding, in getting interviews and in getting job offers. And you're getting a lot of rejections. It's very hard to keep yourself motivated. We know this. So Thrive is also that space where we can support you in maintaining that motivation. It's for you if you don't know how to do this networking that we've been talking about as a different way to get to those jobs that are underwater. It's for you if you're unsure of the value of your CV and your cover letter. We go really in depth in the course on how to build a strong CV and how to build a strong cover letter. And I've mentioned a lot of those things here today. It's for you if you feel that your cover letters are not landing and you're unclear of how to, think long-term about that career building. Or you don't know how to find new opportunities within your field of work. Or even if you just feel like you need a bit more guidance or mentoring on this journey. What you get out of these course, and you can read the testimonials that we have on the webpage, and that my team is already putting the information around Thrive on the chat, is that we help you match your passions and interests to the types of jobs and organizations and sectors. The course also helps you set up a long-term, flexible career development strategy. And having a strategy will differentiate you from 99% of other people who don't have a strategy. It will help you create meaningful relationships, starting with the people you already know that can lead to job opportunities and offers. And this is that long-term networking that we've been talking about in this webinar. It can help you develop efficient job application skills that can lead to job offers that are targeted for you, right? And this is what we've been talking about. How do you do that customization of your CV and cover letter? We talk about self-doubt and imposter syndrome, and it can help you get the tools to overcome this. We also talk about how to build a group of mentors, a mentor board, as I like to call it, that can support you in your career growth, and identify your experiences and skills, even if you think you have no work experience, to showcase them effectively in your CV and in your cover letter and in interviews. So basically, it helps you with establishing the pillars of a successful career in global and public health today when you're at the start of that journey. So if the answers I've given today are not enough for you, if you have more questions, if you have more concerns, if you want a structured way of learning how to do this, learning how to land jobs and how to build a meaningful career, this course might be for you. You can read more on our Thrive webpage, and you can read the testimonials from others. We have now opened tiered pricing depending on the country where you're based. So we want to make this as accessible as possible to everyone. So please check it out. And if it can help you, we'd love to see you in the course. If you have any questions around the course, I'm happy to answer them. Otherwise, I will just use these last 2 to 3 minutes to keep on answering your questions. Let me see. Did I miss anyone? The reality is the job market is saturated, and finding a career is one thing, finding one you actually enjoy is another. Yes, thank you for bringing this up. I think you're totally right. In my experience, some people, just are either very lucky or know very well what they want to do, and then they can go and find that in their very first job. I think for most of us is a bit more of an experiment approach. We try this job, we try this, and it looks very nice on paper, but actually maybe you're sitting day to day in front of your computer and that's not what you wanted to be doing. Or maybe you're just working with numbers and that's not what you wanted to be doing. So jobs that sound very nice on paper, in practice might not be exactly what you're looking for. And that is also one of the reasons why it's so important that you go out and talk to people and ask them to describe how their day-to-day looks like. If there's a person who has a job that sounds interesting to you, go and talk to them. Ask them about it. And then you can better target what type of jobs you think might be meaningful for you, right? The other part about the saturated job market, yes, I'm not going to lie, it is very saturated. You can focus on that, and that's a reality, but there's also the other reality that every day people are landing new jobs. Even young professionals are landing new jobs. And that is also a reality. So those two realities exist at the same time. And one will give you hope and motivation, and the other will drag you down. This is what I call mindset work. What are you going to let your mind focus on? And it's a very important piece of what we cover in the Thrive course, because this is something that will allow you to keep on looking, to keep on doing the work, as opposed to feeling completely overwhelmed and sort of, stop looking, basically. We do believe every one of you can find a job that matches your interests, but it takes time and it takes effort. We are reaching the end of this webinar. I hope I managed to answer most of your questions. I'm very happy to see that so many of you join. What happens next is that you will get an email with the recording in case you missed parts of it, or you want to listen to it again. And if we didn't get to your question today, we do try and answer every single one of the questions, either via email or on our LinkedIn post. So make sure to be following Alanda on LinkedIn, and you click on the little bell and you actually get the notifications when we've posted. And that way you can get the answers to any questions that we didn't get to cover today. Thank you so much for being here. I know it's hard out there right now, more than ever, but I do believe there's a job for each of you, and there's a meaningful job for each of you out there. So I hope you keep insisting and you keep doing the work, because we need you. We need more professionals, excellent professionals in global and public health. So wishing you the best of luck, and we'll see you at the next Alanda webinar. And bye for now.